Thank you. So with my partners on my team, Rod Hirschberger and Alan Carlson, welcome to Mental Health Services, Systems, and Funding. And today we have with us Shani Roby, the President and CEO of First Step of Sarasota, John Thaxton, Senior VP for Community Leadership with Gulf Coast Community Foundation, and as we mentioned, a frequent flyer here at ENZYME, and Mike Moran, who's a commissioner with Sarasota County, who will be here to talk to you guys about the Mental Health Tax District. So what we thought we'd do is we'd have each of our speakers speak for 15 minutes and share some slides if they have them, and then that will leave us about 15 minutes at the end for questions. So the agenda is we're going to start out with Shani Roby from First Step. Then we'll have John Thaxton maybe give us an update on Gulf Coast Here for Youth mental health report that they did with the Brancic Foundation and any other things you feel is important, John. And then we'll end with Mike Moran with the Mental Health Tax District and then open it up for questions. Does that work for everyone? Great. Okay, so Shani, we're going to start with you. So if you want to unmute yourself and if you have any slides to share, if you want to do that or not. Okay.
All right. So hopefully I can get this down if you bear with me momentarily while I pull up my slides. Okay. Are you able to see a presentation?
Yep.
Okay. Perfect. Well, I'll make sure I keep this brief in the time frame that I have. Thank you for having me today. I really appreciate being here in front of all of you. Just a really quick overview about First Step. For those of you who may not know, First Step took over Coastal's organization a little over a year ago. So right now we oversee the substance use disorder piece as well as the mental health piece in Sarasota. Although there are many organizations who do very similar work, we have the crisis stabilization unit and some other things. So I'll show you that in a moment. But I just wanted to be clear that not only are we supported through traditional means like billing, insurance, and things like that, very similar to how other facilities such as ours would operate. We're also supported through state and county funding. We're supported through donations, and we have a lot of support through a lot of our community foundations, such as the Gulf Coast Community, Brancic, Selby Foundation. So there's a lot of people and a lot of organizations who are involved in really helping First Step be successful and thrive. The school system is involved. We have a lot of partnerships with the jails, Department of Corrections, and the list goes on. So there are a lot of organizations and a lot of people involved in making First Step what it is. All right, so I wanted to talk a little bit about the continuum of care here. We have so many services and there's so much that we offer the community. And like I said, a lot of this is not just through our own efforts, but it's through a lot of the collaboration we have with many of our partners. So, and I won't read through the whole list, but there's a few that I want to highlight. Our Crisis Intervention and Access Center Behavioral Health Response Team. I'm going to talk a little bit more in depth about that in a later slide, but I do want to pull that one out just so we can talk about that a little further. The substance use disorder piece, obviously, which is what we do. The acute services, just so you're aware, we now have our detox unit and our crisis stabilization unit. The crisis stabilization unit is key for Sarasota County. It is where we are the receiving facility for all Baker Acts and for Marchman Acts in the entire county. So if there is a situation in Northport where someone needs crisis help, they would end up in our crisis stabilization unit if they needed to be. Additionally, and for those of you who may or may not be aware, the Baker Act is that 72-hour psychiatric hold in a facility so that the person can be assessed and treated. Generally, we look for folks who might be homicidal or suicidal, and that's usually the criteria for a Baker Act. And then on the other side, on the substance use disorder side, there is the Marchman Act. And so we're the receiving facility for the entire county. We also have residential programs, treatment courts, medication-assisted treatments, but we'll go through the rest of the slides and I'll pull out a few of the things that I wanted you to be particularly aware of. So our court program is a brand new program that we have. It's our community offender rehabilitative treatment program. This program launched a couple of months ago. It is largely in part of many partnerships and collaborations in the community. We are hosting that program here and on campus, but judges, the foundations, county commissioners, the list goes on in terms of who all supported this program. So in essence, it's a 120-day program for men. And it actually is sort of a jail diversionary program. People, adult males come here. These are folks who would end up in jail, would end up being on a Marchman Act and ending up in treatment. But it does help a lot. I work very closely with Sheriff Hoffman in that those folks don't necessarily belong in jail. They need treatment. And we follow them for 12 months after they're released from our program to make sure that they have jobs. Some of their basic needs need to be met: housing, food. We hook them up with our case managers. So it's a really, really key program, and it is going to be very impactful in our community moving forward. The next program I want to talk about is our behavioral health response team. And again, I'll say this over and over, it is a collaborative effort among many people in our community to ensure that this program launched. But in essence, it is a team right now of two people who work 24 hours a day. I should say our program is a 24 hours a day, 7-day a week program. What happens is this team will respond to the schools. They'll respond to with sheriff's deputies anywhere where they're needed. If there is if a person is in crisis and they contact our behavioral health response team, we will actually deploy a person and just work with that person to sort of de-escalate what they need, de-escalate the issues. And if you can see here, in the community, just from last January, we've responded to 104 community calls and 210 school-based calls. And so in essence, if you can see here, we have a diversion rate of 85%, which is amazing because those people would likely either be in jail or they would have been Baker-acted. And it's an awful thing for someone to have to go through if they don't have to, especially children. But we respond night and day. We'll get calls at 3 o'clock in the morning, and the response team member will hop out of bed and drive to Northport, drive wherever they're needed within Sarasota County. So this is a really vital piece that we are able to have here with obviously with the help of so many others that help this program come about. But one of the things we need to do is help work on expanding this program and making it more robust, seeing as though we have 2 people doing it right now. Next slide, I want to talk about our Access Center. The Access Center that we have here goes along with what I was talking about earlier as it relates to the crisis intervention for Sarasota County and the substance use disorder piece. So essentially what happens is the Access Center is open and anyone can show up in any condition. And essentially what should happen is that the person is evaluated. They're evaluated for whatever their needs are. And then once there's a determination of what is necessarily going on with them, the person may or may not be admitted. They may end up having to detox. They may end up on a Baker Act. But also the Sheriff's Department uses this Access Center to, as they pick up people in the community, to they'll drop them off with us at any time of day or night and we receive them. We get referrals. Some people walk in on their own. We get referrals through different community partners, people just showing up at our Access Center. Right now, our current staffing plan is 1 full-time clinician, and people can walk in from 8:30 to 4:30. So I want to talk about, in my last slide, the concept of no wrong door and some of the challenges we face as it relates to the programs that are vital to the community. So one of the things as it relates to access is the idea of this no wrong door. Our access center is really there for anyone who is in crisis. But as I mentioned before, our access center is only open from 8:30 to 4:30 for people who can walk in. Now, we're always available to police and everything else. But it does lend itself to an issue because, as we all know, people are not in crisis only between the hours of 8 and 4, Monday through Friday. So that's one of the things that we need to, we need help in expanding. Really, the access center should be open 24 hours a day, 7 days a week. We should be able to receive people at any time. The other issue and challenge that we sort of have as it relates to the access center and detox units is, if you recall in the beginning, First Step and Coastal were two different organizations. So it was never designed so that someone could walk into one door and be helped. Right now, there's several doors where you'd have to sort of go through, depending on what's going on. So ideally, at some point, we could collaborate, or we could move campuses or combine campuses so that there would truly be one door for someone to walk in. And I liken it to if you went to a general hospital with chest pains, for example, you walk into the hospital and it really shouldn't be for you to determine what kind of chest pains am I having? Is this really severe? Did I go to the right emergency department? Should I have gone to the one down the street? When you get to the one down the street, they're like, well, you should have called this number, that. And that's not how that's supposed to work. And when people are in crisis, they need help immediately. So that's some of the challenges that we need to overcome. And like I said earlier, with the behavioral health response team, it is such a good program. It does so much good for this community. And kudos to everyone who helped put that together. But I work very closely with the Sheriff's Department, and the need is so great for people to be able to respond with them. They are not, the Sheriff's Department is so pressed for things that they have to do and have to respond to. And we have this response team and we're the experts in that. So those are some of the challenges and I'll say opportunities as well that we have in terms of the things that we do that serve our entire community, and some of the things that we do that are unique to us. Obviously, there's so many organizations in our community that do a lot of pieces to this, but we are the ones who are the receiving facility for Sarasota County. And then just finally, in closing, just tying all of those things together, there are so many people doing great work in our community, and we need to be better interconnected with all of those pieces. There's primary care pieces, there's other services that these folks need. And if a lot of these, and the folks that we serve, a lot of times if their basic needs aren't being met, they're not going to be able to focus on this part of it. So just that connectivity with everyone who's doing all the work in this community is something that is a great opportunity for us. So that is my last slide. And so I can stop sharing my screen.
Thank you, Shani, and in under time. Go girl.
All right.
All right. John Thaxton, are you ready? You're up next, buddy.
Thank you, Emily. I think I'm ready. And I think y'all know that I have my colleague Jennifer Johnson on the line. It's kind of like that TV show where you get to dial in for help or something when you get a question that stumps you. I work at a very high level at Gulf Coast. Jennifer is capable of working at a level of detail that I'm not able to do. And so I rely on her greatly to keep me on the straight and narrow. So if I defer to her with questions or additional comments, please excuse my ignorance and reward her for all the good work that she does in the community. So back in 2018, the school district, several law enforcement agencies and youth serving organizations came to Gulf Coast Community Foundation and told us that the greatest challenge facing their region from their perspective at that time was inadequate mental health care particularly in early treatment before individuals reach a state of crisis. So in response to that, the Gulf Coast Community Foundation and the Charles and Marjorie Baranczyk Foundation launched the Here for Youth Mental Health Initiative. The goal, to increase high quality services and support available to all Sarasota children and youth needed to improve their mental health. We convened over 70 meetings with community partners, with leaders in order to determine the strategy. Now you might ask why we selected youth. And the reality is that the mental health needs of our community are so vast, attempting to tackle them all at the same time would have proved probably to be insurmountable. So we decided to focus on youth, but many of the providers that work in the youth services also work in adult mental health services, and youth seem to be an indicator of system-wide conditions throughout the county. So recognizing that you cannot change a system piecemeal because everything that we work with is interconnected, the initiative looked at the entire continuum from prevention to recovery support using a public health model. To help us determine a baseline, Gulf Coast Community Foundation and Baranczyk commissioned the University of South Florida College of Behavioral and Community Services to conduct a county-wide mental health scan of the strengths, the gaps, and the finances of the existing system in Sarasota County. Again, focusing on youth under the age of 25 years. USF estimated that the cost of untreated mental health issues in the youth alone in Sarasota County is in excess of $86 million. Now, again, that's youth alone. If we were to add adults in there, it's clearly in excess of $100 million a year. And these costs with youth are primarily driven by the need for child welfare costs, loss of productivity, and the treatment for self-harm, incarceration, and suicide that our youth are experiencing as a direct result of not having access to a robust mental health treatment system. Our region has one, again, back to some of the results of the USF study, our region has one of the highest rates of children entering foster care in the entire state. Most of the children entering foster care are doing so when they're under 5 years of age, a very, very vulnerable age. Substance abuse, domestic violence are the leading causes of children being removed from their parental homes. And we are seeing all of these rates increase as a result of COVID. Additionally, Sarasota County has one of the highest teen suicide rates in the state of Florida. The USF study recommended a dedicated funding source to meet children's mental health needs. Their bottom line is that we cannot afford not to invest in the mental health of our children and their families. Another key recommendation was to focus on eliminating the stigma associated with receiving mental health care. In other words, start treating mental health care like healthcare, where there's no shame involved. Additionally, Gulf Coast Community Foundation commissioned McKinsey & Company, a national consulting firm of renown in the mental health field, to conduct a financial analysis to determine services currently being funded across the continuum in Sarasota County, and to estimate potential ideas for getting us to what we would consider more of an ideal state. The most cost-effective strategies are prevention and early intervention. That means reaching youth. Services that cost the most, such as some of the services that Shoni referred to in emergency care services at our hospital inpatient care, often occur when we have failed to foster resilience and prevention and treat illnesses and support the recovery. Services such as mobile crisis response and community-based residential treatment in Sarasota are woefully inadequate. We're reliant on ED and inpatient care, and we can certainly do a lot better than that. There is an opportunity to reduce the chance that youth will need high cost, high complex services by investing in ROI positive initiatives focused on, first, dedicating resources to support families in navigating the care that is available. Secondly, increasing support for resources available in mental health crisis situations, and also increasing the availability of different models that treat complex mental health needs without requiring removing the child from the home. We believe after these two extensive studies have been contracted by and completed by Gulf Coast and the Charles and Marjorie Barancik Foundation, that probably no additional studies are needed. These studies have been critical tools in the county's mental health advisory committee. I'll talk more about them in just a half a second. Really what is needed desperately is additional dedicated funding to meet these gaps in services that we're presently experiencing in our mental health field. Of interesting note, in 2007, that was 15 years ago, Sarasota County spent just a little bit over $11 million in health and human services program, and that included mental health. Over the average of it since 2005, we've been spending about $8.5 million on our health and human services. That number today is the same as it was in 2007, around $11.5 million. So despite the increase in demand, the increase in population, the COVID, et cetera, our funding levels have remained relatively level over the last 15 years. The American Academy of Pediatrics has declared the pandemic-related decline in children's mental health a national emergency. This is unprecedented. This has not been heard of ever in our lifetime, or for that matter, the existence of the American Academy of Pediatrics. Youth ages 0 to 24 years are the focus of the Gulf Coast Barancik efforts because 3/4 of all chronic mental illnesses began before the age of 24. So our thinking is that if we can build the system and we can intervene early, then a lot of the expensive mental health treatment downstream will be avoided. A mental health task force of subject matter experts will submit their recommendations to the County Commission January the 25th. We applaud the Board of County Commissioners for convening this task force. They are indeed experts in their field, and we look forward to their recommendations to the County Commission and to the community. Their work builds on research that I've talked about earlier that will look towards filling the gaps and finding the best return on investments in order to improve the mental health system in Sarasota County. The bottom line thought that I would like to leave this group with is virtually every study that we have seen, both locally in the state of Florida, which is, by the way, the state with the or one of the lowest per capita funding of mental health and behavioral health. Louisiana might have surpassed us last year because of some COVID-related expenses that they did, but we are at the bottom of the heap in the entire country for mental health funding. Sarasota County is behind the 8 ball today, and in absence of an increased dedicated funding source to address these needs, one can count on that unmet need cost of treatment not being available to increase dramatically as a result of COVID in the next couple years to come. Thank you, Emily.
Thank you, John. And I think you teed up Commissioner Moran perfectly. So I'll pass it over to you, sir.
Yes, thank you, Emily. I really appreciate being invited here this afternoon, or I guess it's evening now. And Shawnee, you got two great speakers. Shawnee, just congratulations on your new position there. I think you're going to do fabulous things. Frankly, you already have. And John, your leadership in this is just is absolutely recognized by me and appreciated a ton. So before we started here, I put my cell phone number and how to get a hold of me at the county with Robin, helps with some scheduling. So if anybody has any afterthoughts, feel free to reach out to me, however is easiest for you. But specifically to this conversation of a mental health care special district, all of this is wrapped around a Florida statute 154.331, which is incredibly flexible. It basically lets a local community do whatever they need or want to do to address these topics. The only real constrictive nature to it is you're not allowed to bond. So choice creates stress. You can literally structure this and design it however you want for your community. Specifically, what we were faced with at the county is there's pretty much two big filters there. Is one, you can have an independent district or you can have a dependent district. Originally, I wanted an independent district, and after lots of conversation between the commissioners, we decided on a dependent district. I'm hopeful we might explore that again as far as moving to an independent. I'll just take a couple minutes on that. Under the independent district model is that you put that out for voter referendum. The voters vote on it. The structure of the entity, if it's an independent, which we're not, but if it becomes an independent on this board or future boards decide to do that, is the governor appoints 2 people to that board. The county commission appoints 3 people to that board, with the local community having a majority of that board, hopefully for obvious reasons of control. But it does have 2 gubernatorial appointments and 3 Sarasota County commissioners. You're allowed to have more, but that's at a minimum. They set the millage rate. They're statutorily, the maximum you can do is 5 mills. You set your own budgets. You create the millage rate that fits that budget. Again, no bonding, and you put the bylaws, rules, and regulations in place to control that independent district. The model we're under now is a dependent district. We chose to go that way with it. And under the dependent district, it's related to unincorporated for Sarasota County. We have total control at the Board of County Commissioners of dialing the millage rate as necessary. The example I use is it's very similar structure, believe it or not, to our mosquito management, but that's the structure that it's in place now. I should have started with, it's very, very important to me, especially for the leadership on this call, is, all of my comments are personal. We've been very aligned as a commission. We get along very well. We probably disagree on 20% of things. And when we do, it's very healthy debate and discussion in the interest of the taxpayer. But all my comments today are obviously my personal ones as a commissioner. But again, I don't speak for any other commissioners. Believe me, they'll speak for themselves in a very good way representing you on this call. But throughout those debates and input from the community, if you ask me, they basically filter down to 2 major discussions, and I'm happy to have those beyond this video call. Is the one frame of mind is the government needs to come up with a solution for this. The other school of thought is the government shouldn't be within 100 miles of this. This should be faith-based community efforts, foundations, many of on the call here, philanthropy, nonprofit world, and the government staying out of it. As a community, I think we have a healthy discussion, and we're in it right now, as we kind of have a hybrid here in Sarasota County, which I share very much that modeling. In our last retreat in December, we made a commitment as a board is that if there's taxpayer dollars involved of more than $500,000 to any one entity, that we have the option, not the demand, but we have the option to put a taxpayer representative on the board of that entity to represent that over $500,000 of taxpayer money. So be curious to see how that goes about. I'll be on 2 of those, I believe. But I think that's just a healthy representation of, if you've got skin in the game, of having somebody that is elected by the taxpayers to be on that board and have a say. So that's kind of like the government backdrop of this. My personal commitment to this is I'm the chair of the Department of Juvenile Justice Advisory Board. I have been for a number of years. I've been a guardian ad litem for Sarasota County well before the political thing, representing children in the foster care system. My wife is responsible for the day-to-day operations of teen court. So we have a front row seat of this personally and professionally, and we care a lot about it, have a lot to say about it. A personal note, I'm not an expert in these topics. I'm like everybody else. I have thoughts and ideas, but there's people that have lots of letters behind their name that are that are professionals in this area. I am not a subject matter expert, but there's some common sense that goes along with it. My personal opinion is we're starting to see a tsunami, not a wave, but a tsunami of these young adults that are coming about that grew up on this technology. There's a new wave of these young adults that are coming into adulthood that grew up with a cell phone plastered to their face. These, at a very young age, they were seeing stuff that frankly, again, I'm no expert, but I'm a parent, and it's troubling, frankly. And I think we're starting to see that tsunami hit the ground, if you ask me. You know, the example I use when I communicate this, as my wife deals with a teen court, is that you might have a situation where a young adult gets caught shoplifting or fighting or smoking dope behind the school, whatever. But they come into the system of the teen court as a diversion program, and they build trust with the case managers. And all of a sudden you start to see a bigger picture well beyond shoplifting. You've got a father that's an alcoholic, a mother that's experiencing abuse, as John mentioned, massive financial problems in the household, and these children are showing the first signs of acting out on this. This is an incredibly complex situation. Anybody that suggests there's an easy button to this, I respectfully disagree. If we're talking about mental health issues, is different than mental health issues with substance abuse, which is different than mental health care with substance abuse and childhood trauma. These are all incredibly complex discussions. I could come up with 100 examples. That's just one. One of the things that I'm personally pushing for is, again, I represent taxpayer money and getting a return on it. One of the things that I think is a common sense discussion is much of this money should go to direct payments for licensed professional counselors for families to find their way throughout some of these very, very complex issues. So, you know, some of the debate that comes up is, where does the government fit into this conversation? Well, I think John alluded to it, some of it in the studies they've done, is that there is a massive, massive financial canyon between someone that is an adult that has meaningful employment, is actively participating with their families, maybe even in addiction treatment. Again, strong family relationships and strong employment, their children being actively at school and participating towards their education and beyond. The difference between that and some of these folks being involved in the community with the law enforcement, in our incarceration, the Department of Juvenile Justice and the Hospital Baker Acting that Shawnee was speaking of, and the transition into some of this in and out of homelessness, is to suggest that the taxpayer isn't paying for that. I can assure you that's not the case. You're paying for it one way or another, if you ask me. Again, very, very open to conversation on this. As far as the debates that come about, at people that are subject matter experts of, is this illness versus behavior issues or punishment versus treatment? I'll leave that for others. My job is how to bring about the proper funding to address this. Is yes or no, is this a priority for the community? If it is, how much are you going to dedicate funding to deal with it? And then lastly, being very, very measurable and back to the taxpayer of a return on investment of this and showing success. As John mentioned, on January 25th, where the subject matter experts are going to come with their suggestions on this. I think for my board and any future boards, these subject matter experts need to be hand in glove with these subject matter experts, because this might evolve over time. In the 80s, there was crack issues. You know, they didn't even talk about some of these drugs that exist now. Is that might be very different 10 or 15 years from now. It's important for me to set the model up for future boards to deal with. And lastly, my 2 cents on that, but I'm listening closely, is I think, like we do with many other things at the county, is getting some very specific filters and the pie chart of how that money is supposed to be spent. If I told these subject matter experts, I met with every one of them individually, and I said, I'm not interested in getting an inch-thick document that says you need to spend more money on mental health care. A third grader knows this, if you ask me, is I need very specific input and opinion on how the money should be spent, and very, very specific on showing the gaps and where the overlaps exist in our community. And again, some of the folks on this call have already done a lot of great work on that. Is that pie chart should be real. If you ask me, the filter should be real big at the top. Are you going to spend money on prevention versus treatment? Prevention versus treatment. What's the Excel spreadsheet? Are you spending 50-50, 70-30, 80-20 on prevention versus treatment? And the second big filter is adults versus youth. If you can have an intellectually honest conversation of prevention versus treatment and how much you're going to spend versus adult versus youth, I think you've narrowed it down. After that, it's just good service providers in the community and getting a measurable return on investment for the taxpayer on this. But hopefully, Emily, that's what you were looking for, and hopefully dovetailed with John. John and I, we don't need to prepare for any of these meetings. We come right in and we kind of have different perspectives on it, and they're usually very healthy and excellent conversation, but hopefully that's what you're looking for tonight.
Thank you, Commissioner.
Great, thank you. And my team member, Rod Hirschberger, had a really good idea to see if David Verinder would be interested in sharing SMH's involvement in treating mental health issues.
Oh, thanks, Emily. I wasn't prepared, but I will tell you what we're doing right now. We're also have our fair share of Baker Acts and Marchman Act patients here. We are putting a lot of money right now into a new behavioral health hospital. So I think everybody probably knows we have a facility right now, Bayside, on the corner of Baltimore and Osprey. It's seen its time both in facility and kind of the programs that it has. We have been recruiting new physicians and we've torn down buildings, and we're about to start a new building on the corner of Osprey and Waldemere on the east side of Osprey. That is going to not just be inpatient, but also outpatient and partial hospital stay, and really state-of-the-art design. As you can imagine, it's not a whole lot of reimbursement or anything into that. So this is really something we see as filling a community void. It'll be 83 beds in that, all private rooms, and really designed around treating the patient in a much more advanced way than how they're treated now. We did have a community member step up and name the facility and put up some money for it. But most of the money obviously comes out of the healthcare system. I'm not exactly sure if we're on, Mike Moran. I'm not sure if we're on the committee right now or not. But we have certainly would like to participate in what the county's doing and think we have a piece of that. And I know we've put up people before, but if they're not on the committee right now, I'd certainly volunteer to have some of our experts sit in on that.